Okay, let's unpack this. If you're a cat owner, you probably know that little knot of worry when something seems off with the litter box routine.
Definitely.
So today, we're doing a deep dive into one of the big reasons for those worries, issues in the lower urinary tract. And we're focusing specifically on problems tied to struvite.
Right, struvite crystals and stones. We're digging into insights from a really detailed veterinary text here, looking closely at what it says about feline struvite urolithiasis and, importantly, urethral plugs, too.
Exactly. Our mission really is to guide you through this. It can seem complex, but we want to use this source material to clear up the confusing bits.
Yeah, like what actually causes these things, how vets figure it out, and crucially, what the source points to as the best ways to treat them, and maybe even stop them coming back.
We're aiming to pull out the absolute must-know info for you from this text.
It might sound a bit technical, but we'll make it clear. Think of it as getting the key takeaways without having to read the whole dense thing yourself.
Or we'll definitely highlight the really interesting parts.
Okay, so first things first. The source makes a really big point right at the start about a fundamental distinction. You absolutely have to get this. Struvite uroliths, the actual stones, are different from struvite urethral plugs.
Okay, so not the same thing. That seems important.
Yeah.
What's the core physical difference then, according to the text? How are they distinct?
So a struvite urolith, the stone itself, is described basically as a hard crystalline structure. It's mostly mineral, the magnesium, ammonium, phosphate stuff.
Just a solid little rock, essentially.
Pretty much, yeah. Maybe a tiny bit of other material, what they call matrix, mixed in, but it's overwhelmingly mineral.
Okay. And the plugs, how are they different compositionally?
See, the plugs are structured quite differently. The source says they often contain large amounts of this matrix material mixed with the crystals.
Matrix. What exactly is that? Is it mineral too?
No, and that's the key. This matrix isn't mineral. It's more organic stuff. The source mentions things like sloughed cells from the urinary tract lining, blood cells, inflammatory cells, sort of protein-based material.
So less like a rock and more like, I don't know, a gritty paste.
That's a decent way to think about it sometimes. The crystals are kind of bound together by this protein-rich cellular goo. Or sometimes the plug can be almost all matrix with very few crystals.
Okay, I can see why knowing that difference would be huge for, say, trying to treat it. That composition difference must really matter.
Exactly. It affects how they behave in the body and the potential treatment approaches.
Now, this next bit from the source, this is where I thought it got really fascinating. The history. The text brings up data from the Minnesota Urolith Center.
Oh yeah, that data is striking.
It shows this massive shift in the types of stones vets were seeing over time.
It really is dramatic. You look back to, say, the early 1980s, around 78%, almost 4 out of 5 feline stones sent in for analysis were struvite.
78%, that's huge.
But then, fast forward to the early 2000s, or around 2002, that number just plummeted, down to only 33%.
Wow, from nearly 80% down to a third. What was going on? Was something else replacing it?
Exactly. While struvite was tanking, another stone type, calcium oxalate, was doing the complete opposite.
Calcium oxalate.
Okay. It went from being pretty uncommon, maybe only 2% of submissions back in the 80s, to becoming the most common type by 2002. It hit about 55%.
So they literally swapped places in terms of frequency over those couple of decades.
Pretty much, yeah. It was a major shift. But then things changed again.
It didn't stay that way.
Nope. After 2002, struvite started climbing back up. By 2005, it was at 48%, and by 2013, it was still around 46%. Calcium oxalate, meanwhile, dipped a bit again.
That's quite the roller coaster. Up, down, back up again. And the source doesn't just show the numbers, right? It connects this to something specific.
Yes, and this is the really powerful insight from the text. It explicitly states that these huge swings in stone types paralleled changes in the formulation of manufactured cat diets during those same time periods.
Ah, okay. So the food changed, and the types of stones changed right along with it.
The link is presented very strongly. It really suggests that what's in the bag or can has a massive impact on which type of stone cats are likely to develop.
Yeah, that's pretty compelling. Really makes you think about the impact of commercial diets. So where does the source say things stand more recently, based on the data they had?
Well, based on the data presented in the text, struvite was making up around 50% of all lower urinary tract stones in cats. So about half.
Still a very significant issue then.
Definitely. And here's another key detail. About 95% of those struvite stones are described as sterile.
Sterile meaning? No infection involved.
Right. They form without a bacterial urinary tract infection being the main cause. The source also notes struvite shows up in about 8% of kidney stones nephroliths.
And what about the plugs? Where does Struvite fit in there?
It's still the main player. Since the 80s, struvite mineral has been the most common mineral found in about 90% of those matrix crystalline urethral plugs.
Got it. So still a huge factor in plugs, too. Okay, so it's common. Who gets these problems? Does the source talk about typical age, sex, anything like that?
It does focus mostly on age and sex. Species is cats, obviously. For Struvite uroliths, the stones, the text gives a mean age at diagnosis of about 7 years old.
Okay. Middle-aged cats, typically.
On average, yeah. But the range is huge. They've seen them in cats under a year old all the way up to 22 years old.
Wow. Okay. And does that sterile versus infection-induced thing play into the age?
It seems to. The source points out the sterile struvite stones usually don't pop up in really young, immature cats.
Okay.
But if it's infection-induced struvite caused by bacteria, then yeah, you might see that in younger cats.
That's a useful distinction. What about males versus females? Is one more likely?
This is another really key difference the source highlights, and it depends on whether you're talking stones or plugs.
Okay. Let's start with stones, the uroliths.
For struvite uroliths, it's actually slightly more common in females. The text says about 55% of cases are female cats compared to 45% in males.
Huh. Okay. Slightly more females for the stones themselves. What about the plugs, the ones that cause the blockages?
Right. This is where it flips. Struvite urethral plugs predominantly affect males.
And I guess that goes back to what you mentioned earlier about anatomy.
Exactly. The source explicitly identifies the male cat's anatomy specifically, the normally very narrow diameter of their urethra towards the end as a major risk factor. It just makes them way more susceptible to getting blocked by plugs or even by small stones trying to pass.
That makes perfect sense. So as an owner, what might you actually notice? What are the clinical signs the source describes if your cat has one of these struvite issues?
Well, the signs can really vary. It depends on where the problem is located. Bladder, urethra, kidneys, and how big the stones or plugs are, how many there are, and critically, whether they're causing an obstruction.
Right. Can cats have them and show no signs?
Yes, absolutely. The source mentions some cats, especially those with just bladder stones, can be asymptomatic. You might not know anything's wrong.
But for the ones with symptoms, what's typical?
Okay, so if you've got bladder stones, what they call urocystoliths, or maybe stones in the urethra, urethral, that aren't causing a full blockage, you typically see signs like the cat trying to pee much more often, maybe just little squirts, that's polyuria, straining or difficulty urinating called dysuria.
Painful looking.
Yeah, it can look uncomfortable. Also, peeing outside the litter box, which they term periuria, and blood in the urine, hematuria. Sometimes with urethral stones, the source says you might even see the cat pass tiny, smooth stones.
Okay. Now, what about the really scary situation, the blockage?
Right. If there's a significant outflow obstruction, which, again, is common and really serious with plugs or stones in male cats, the signs are much more dramatic and urgent.
Like what?
The source describes the cat having a large, firm, very painful bladder that you might even feel, and then you get systemic signs because the toxins are building up. Things like loss of appetite, maybe vomiting, that's postrenal azotemia kicking in.
That sounds like a true emergency.
It absolutely is. And just quickly, if the stones are up in the kidneys' nephroliths, the signs might be different again. Maybe increased drinking and urination, what they call polyuria and polydipsia.
Got it. So a range of signs, but obstruction is the big emergency. Let's talk about why. What risk factors does the source point to for struvite formation? Let's start with the sterile kind.
Okay, for sterile struvite stones, it really seems to boil down to the urine chemistry and concentration, and diet plays a huge role there.
Makes sense given the history we discussed.
Yeah. The source lists factors like the specific mineral content of the food, magnesium, phosphorus, also energy density, moisture level.
Low moisture meaning more concentrated urine.
Exactly. Also, things in the diet that make the urine more alkaline, less acidic. The amount of food eaten matters, how it's fed, like free feeding versus meals. And then factors related to the cat, like just naturally producing a very concentrated urine, or maybe things that cause them to hold their urine for longer periods.
So lots of diet and urine factors for sterile stones. What about the infection-induced ones? What drives those?
That's more straightforward. The main driver is a urinary tract infection, a UTI, but specifically with bacteria that produce an enzyme called urese.
Urese. Okay.
This enzyme breaks down urea, which is normally in urine, and that whole process creates byproducts like ammonia and raises the urine pH, makes it alkaline. That chemical environment is perfect for struvite crystals to form.
So the bacteria basically change the urine chemistry to favor struvite.
Exactly. Other risk factors mentioned include anything that compromises the cat's natural defenses against UTIs. This can sometimes happen after certain surgeries, like that perineal urethrostomy surgery we mentioned, and also just having enough urea in the urine for the bacteria to work with.
And just to confirm, that male anatomy thing, is that listed as a risk factor too?
Yep. The source is clear. The smaller diameter of the male cat's distal urethra is a physical characteristic that counts as a risk factor, predisposing them to obstruction by either plugs or stones.
Okay. Signs noted, risks understood. How does a vet actually figure this out? How do they diagnose it and confirm it's struvite? What does the source say vets use?
Well, first, they need to rule out other things that cause similar signs, like simple inflammation or even behavioral issues. Then, if stones or plugs are suspected, the goal is to identify what kind.
So what tools do they use? Urine tests, I assume.
Oh, absolutely. Urinalysis is key. They look at the urine under a microscope for crystals, specifically magnesium ammonium phosphate crystals for struvite.
And what do those look like?
The source gives a pretty vivid description. They're typically colorless, three-dimensional prism shapes, often described as looking like coffin lids.
Coffin lids. Okay, that's memorable.
Yeah, they have this sort of orthorhombic shape, 3 to 8 sides. Seeing those is a strong clue for struvite.
Does finding crystals mean stones are definitely present?
Not always, but it's suggestive. Now, about bacteria. This is interesting. Do they always culture bacteria if it's there?
Yeah, you'd think if it's infection-induced, the culture would be positive.
You would, but here's a surprising point from the source. It states that even in cats confirmed to have sterile struvite stones, routine urine cultures are positive only about 1–3% of the time in cats aged 2 to 7 years.
Only 1 to 3%. Wow. So a negative culture doesn't mean much for ruling out sterile stones.
Exactly. It definitely doesn't rule them out. Now, if you suspect infection-induced stones, a positive culture is obviously more likely and helpful for choosing antibiotics. But you can't rely solely on culture either way.
That's really important context. What about seeing the stones? Imaging, x-rays, ultrasound?
Yep, imaging is crucial. Radiography x-rays are very helpful because struvite is generally radiodense.
Meaning it shows up white on the x-ray.
Right, it usually contrasts well so you can often see the stones, but the source adds a caution. Just looking at an x-ray isn't super reliable for getting an exact count or size of the stones, and that info matters if you're thinking about dissolving them.
Okay, so x-rays show them, but maybe not perfectly. What about ultrasound?
Ultrasound is another useful tool. It can also detect stones or plugs, show their location, give an approximate size and number, but it has its own quirks.
Like what?
The text points out ultrasound tends to overestimate the size of stones but underestimate the number compared to what's actually there, and it doesn't show density or shape as clearly as x-rays.
So both have pros and cons. Are there ways to get a direct look inside?
Yes, cystoscopy. That's where they use a small camera on a scope, insert it into the urethra and bladder.
Right, like an endoscopy for the bladder.
Exactly. It lets the vet directly see the location, number, size, and shape of any stones or plugs right there on screen.
And what about confirming for sure what the stone or plug is made of?
This is the gold standard, according to the source. Quantitative mineral analysis of the actual stone or plug material after it's been retrieved, maybe passed, flushed out, or surgically removed.
Sending to a lab.
Yep. That's considered the accepted standard of practice. It's the most definitive way to know if it's struvite, calcium oxalate, or something else entirely.
That makes sense. Know your enemy.
Right. And the source adds that when pathologists look at urethral plugs, besides the mineral and matrix, they might also find things like red and white blood cells, bits of tissue, even bacteria or viruses mixed in.
Okay, so diagnosis is a combination of things: urine tests, imaging, maybe scoping, and ideally analyzing the stone or plug itself. Once it is confirmed as struvite, what are the treatment options the source describes?
Okay, treatment approach depends mainly on whether it's sterile or infection-induced, and if there's an obstruction. For sterile struvite uroliths in the bladder, the standard recommendation is medical dissolution.
Medical dissolution. You mean trying to dissolve them without surgery?
Exactly, using special therapeutic diets.
Like prescription foods.
Yes. The source mentions the prototype diet developed for this, Hill's prescription diet Feline SD, as an example. These diets are formulated to change the urine chemistry, make it more acidic, dilute, and lower in the building blocks for struvite to encourage the stones to dissolve.
How long does that usually take? Is it quick?
The source suggests it typically takes about 2 to 4 weeks for dissolution with that type of diet. It can vary, of course.
Okay. And what if it's infection-induced struvite? Diet alone won't cut it then, right?
Right. For infection-induced stones, the diet is still used, but it has to be combined with appropriate antibiotics.
Based on that culture and sensitivity test, presumably.
Ideally, yes, to make sure you're targeting the specific bacteria effectively.
And sticking with the treatment must be important.
Hugely important. The text really emphasizes client education here. Owners have to understand they must feed only the prescribed diet. No extra treats, no table scraps, nothing else.
That can be tough for some cats and owners.
It can, and for infection cases, finishing the entire course of antibiotics, even if the cat seems better, is absolutely vital. The recommendation is actually to continue the dissolution diet for about a month after x-rays confirm the stones are completely gone.
A whole month after. Wow. Okay. To make sure.
Presumably to ensure any remaining microscopic crystals are also dissolved and to allow the bladder lining to heal.
What about canned food versus dry? Does the source mention moisture?
Yes, it highlights that canned or moist versions of these therapeutic diets are generally preferred.
Why is that?
More water intake. It helps dilute the urine, making it less concentrated with those stone-forming minerals. Plus, drinking more usually means peeing more, which helps physically flush the urinary tract.
Makes sense. Are there other medications used sometimes besides antibiotics?
Yes, for managing symptoms. The source mentions potentially using buprenorphine for pain relief, giving a suggested empirical dose.
Okay.
And for bladder spasms, or that feeling of urgency, they mention possibly using tolterodine, which is an anticholinergic drug, again with a suggested empirical dose.
What about when diet isn't enough or isn't appropriate, like with blockages or stones outside the bladder?
Yeah.
When does surgery or other procedures come in?
Right. Surgery or other interventions are needed in several scenarios. Definitely, if there are urethral stones causing an obstruction, those usually can't be dissolved medically where they are. Also for urethral plugs causing blockage, obviously. If medical dissolution fails or isn't feasible, or if the stones keep coming back despite prevention efforts. And for stones in places like the ureters, which connect the kidney to the bladder, those generally aren't dissolvable.
So what kind of procedures are we talking about?
The source lists a few common ones. There's retrograde urohydropropulsion.
Whoa, say that again.
Retrograde urohydropropulsion. Basically, using sterile fluid flushed backwards up the urethra to push obstructing stones back into the bladder.
Ah, okay. Push them back to where they might dissolve or be easier to remove surgically?
Exactly. There's also lavage, which is just flushing the urethra or bladder to clear out debris or plugs. Voiding urohydropropulsion is another technique to help flush small stones or plugs out while the cat urinates, usually under anesthesia.
An actual surgery.
Yep. Cystotomy is the surgery to open the bladder and physically remove stones. For male cats with recurrent blockages from plugs or scarring causing narrowing strictures, that perineal urethrostomy or PU surgery might be recommended.
That's the one that widens the opening.
Essentially, yes. It creates a wider urethral opening, more like a female cat's anatomy, to make obstruction less likely. They also mention potentially needing surgery to correct any underlying anatomical issues predisposing the cat. And laser lithotripsy, using a laser to break stones up, is mentioned as another option.
Lots of options. And after surgery?
A critical point the source makes. Always get post-operative x-rays to confirm all stones or fragments were actually removed. You don't want to leave any behind.
Oh, good point.
Yeah.
Are there any treatments or meds that should be avoided in these cats?
Yes, there's a specific warning. Do not give urine acidifying medications to cats that are azotemic, meaning they have kidney issues causing waste product buildup in the blood.
Okay, no acidifiers if the kidneys are struggling.
Right. And also avoid them in immature growing cats. Generally, cats with azotemia are considered higher risk for side effects from any drug, so they need extra careful management.
Got it. So treatment's covered. What about after? How do you prevent these from coming back, especially the sterile kind?
Well, during dissolution, monitoring is key. Monthly checks with urinalysis, maybe culture, and imaging to see how it's going. For long-term prevention of recurrent sterile struvite, the source recommends switching to specific maintenance diets.
Different from the dissolution diets.
Usually, yes. These are typically still somewhat acidifying and restricted in minerals like magnesium and phosphorus, but maybe not as extreme as the dissolution diets. They're designed for long-term feeding to maintain a urine environment where struvite is less likely to form.
Should you use acidifying pills with these diets?
Generally, no. The source cautions against adding separate urine acidifier medications unless specifically directed by the vet, because you could overshoot and make the urine too acidic, which causes other problems.
Like potentially forming other kinds of stones?
Exactly. They mention diets formulated to help prevent multiple stone types, like prescription diet CD multicare feline as an example. These aim for a balance of moderate moisture, restricted minerals, controlled pH to try and minimize recurrence risk for both struvite and calcium oxalate.
That sounds useful if a cat might be prone to both. But what if a cat is known to form both types? Which one do you focus on preventing more?
That's a really important management question the source addresses. If you're using an acidifying diet to prevent struvite in a cat that also forms calcium oxalate,
Mm-hmm.
you have to monitor their urine very closely for calcium oxalate crystals. If those start showing up persistently, you might need to change strategy.
How so? Which one takes priority?
The source provides specific guidance here for cats known to be at risk for both types. The primary prevention focus should generally be on the calcium oxalate.
Really? Why prioritize preventing calcium oxalate over struvite?
It comes down to treatability. As the source notes, sterile struvite stones can often be dissolved with diet a non-invasive approach. Calcium oxalate stones, however, cannot be dissolved medically.
Ah, so if calcium oxalate stones recur, you're usually looking at surgery or procedures again.
Precisely. So the thinking is prioritize preventing the type that's harder and more invasive to treat if it does come back. It's a practical approach based on the available treatments.
That makes a lot of sense. What about preventing the infection-induced struvite from recurring?
That's simpler, in theory. It's all about getting rid of the underlying UTI and preventing it from coming back. If you can keep those urethra-producing bacteria out of the picture, that type of struvite shouldn't form. Specific acidifying diets might not even be needed long-term in those cases, just diligent UTI management.
Okay. Are there any common complications owners or vets should be watching out for during all this?
Yes, definitely. A big one is a stone moving from the bladder down into the urethra and causing a sudden blockage, especially in male cats who might already be straining. That's an emergency.
Right, the obstruction again.
Yeah. And that procedure we mentioned, retrograde urohydropropulsion, can sometimes resolve that acute blockage. Another potential issue is that using urinary catheters, while sometimes necessary to relieve an obstruction, does carry risks. It can increase the chance of introducing bacteria leading to future UTIs or potentially causing inflammation that leads to urethral strictures down the road.
So catheters are helpful, but not without potential downsides. Finally, what about timelines? Based on the source's data, how long does medical treatment typically take to work? What's the prognosis look like time-wise?
The source shared some data from their hospital cases. For dissolving sterile struvite stones in the bladder medically, the average time was about 1 month.
Okay, about 4 weeks on average.
Yeah, but the range was pretty wide, sometimes as quick as 2 weeks, but sometimes stretching out to 5 months.
And for the infection-induced ones, needing diet and antibiotics.
Those took significantly longer, which makes sense. The average dissolution time was around 10 weeks.
10 weeks, so over 2 months.
Yeah, with a typical range reported between 9 and 12 weeks in their data set.
So sterile stones generally dissolve faster than infection-induced ones.
Exactly. You're tackling just the stone chemistry with sterile ones, whereas with infection-induced, you're also fighting the underlying bacterial infection simultaneously. Just adds complexity and time.
Well, this has been incredibly informative, a real deep dive into feline struvite. We've covered the crucial difference between stones and plugs.
Yeah, that composition difference is key.
We looked at that fascinating history of prevalence shifts and the strong link to diet changes.
Definitely makes you think.
We identified who's most at risk, remembering that interesting female lean for stones versus the male issue with plugs.
Right, the anatomy factor.
We talked about the signs owners should watch for, from subtle changes to the emergency obstruction signs.
And how vets diagnose it, those coffin lid crystals.
And that surprisingly low positive culture rate for sterile stones, which was eye-opening. Plus, the pros and cons of x-rays versus ultrasound.
And the importance of stone analysis.
Then we walked through the treatments dissolution diets, antibiotics for infection, managing symptoms, and when surgery or procedures like PU are needed.
Plus prevention strategies, including that critical point about prioritizing calcium oxalate prevention if a cat forms both types.
We also touched on complications like obstruction and catheter risks and the typical timelines for getting things resolved.
It really covers the whole journey, from suspicion to diagnosis, treatment, and prevention, all based on the source material.
So, building on everything we've discussed, here's a final thought for you, the listener, to consider, really drawing from the core of this source material. Given that really striking historical data, the way stone types seem to track so closely with changes in cat food,
Yeah.
and knowing how critical that composition difference is mineral stone versus matrix-filled plug for deciding on treatment, how might taking a really proactive stance on understanding exactly what's in your cat's food bowl and being super vigilant about even tiny changes in their litter box habits be even more crucial than maybe you first realized?
And maybe think about this too. Knowing that struvite can often be dissolved, but calcium oxalate can't. How does that information, that practical difference in treatability, shape how you might think about preventative care, especially if your vet identifies your cat as being potentially at risk for any kind of urinary stone?
Just some things to mull over, reflecting on what we've unpacked in this deep dive today.